celebrated as International Women's Day around the world, where we recognize women for their cultural, political and socio-economic contributions to society. And here's wishing all of you listeners a very, very happy Women's Day. Today's women are multifaceted. They not just actually take care of their careers and their personal aspirations, but also of their family. But in all of this juggling, they forget one of the most important things that can support this journey of theirs, and that is their health. Which is why this International Women's Day, Alkem Oncology is spreading awareness about 3 major cancers which are most prevalent in India: breast cancer, ovarian cancer and cervical cancer, through their educational initiative She Beyond Pink 2.0. This would help women know what the screening options available to them or what symptoms would actually look like, so that they can pursue healthier lives dedicated to their passions. Which is why we have today on Radio City our doctor, our expert, who will spread awareness about the same from Alkem Oncology. Thank you, doctor, for taking out your precious time.
Doctor, what is breast cancer and what is the risk associated with it?
Breast cancer is a disease in which cells which are present inside the breast grow out of control. So there are various subtypes of breast cancer, and the type of breast cancer depends on which cells actually grow out of control. Now, if you look at the risk factors for breast cancer, it can be divided into risk factors which you cannot change. For example, getting older, most of the cancers occur after the age of 50 years. Having genetic mutations inherited from our parents. If you have your menstrual period starting very early, before the age of 12, and if you continue to have your periods above the age of 55 years, what happens is your body is exposed to hormones for a longer period of time, and hence the chance of getting breast cancer increases.
Doctor, what are the symptoms of breast cancer and how can it be prevented?
So the commonest symptom of breast cancer is a lump in the breast or in the armpit. The other symptoms are thickening or swelling of part of the breast, irritation or dimpling of the skin of the breast, redness or a flackiness in the nipple area, the nipple area being pulled in or having severe pain in that area, discharge through the nipple other than milk, including a bloody discharge, and sometimes just a change in the size and shape of the breast. Very rarely you'll just have pain in the area and nothing else, and on examination the doctor will pick up a lump. How to prevent breast cancer? I told you what are the reasons for breast cancer which you can change. So one of the areas how you can prevent is by not consuming unnecessary hormones and by being physically active and maintaining your body weight. The other way is to pick up cancers in an early stage by doing mammograms. So above the age of 40 years, if you do regular mammograms, once in 2 years preferably, you will have a good chance that if you get breast cancer, it would have been picked up in an early stage. Because sometimes if you want to pick up cancer in the early stage, it should be picked up before your hand feels it. If you are below the age of 40 years, mammograms are not that good, and hence ultrasound of the breast is a good way of picking up early cancers.
Doctor, what is ovarian cancer and what are the risk factors associated with it?
Ovarian cancer is a cancer arising from the ovaries, which is an important part of female reproductive system. So if you see the female reproductive system, there are ovaries, there are fallopian tubes and uterus. So cancers arising from the fallopian tube as well as ovaries put together termed as ovarian cancer. And also there is something called primary peritoneal carcinomatosis, which is the cancer arising from the peritoneum, which is an overlying part inside the abdomen, which is called peritoneum. So the cancers arising from the peritoneum are called as peritoneal carcinomatosis. All these 3 cancers treated in a similar way, that is like ovarian cancer. And if you look at the risk factors, the familial ovarian cancer, hereditary breast and ovarian cancer syndromes are there, which accounts for around 10 to 15% of the cases. And if you see other risk factors, like obesity is one of the risk factors. Nulliparity may be a risk factor. And if you have child after the age of 35, the chances of ovarian cancers are high. So all these risk factors are there. Some of the risk factors are modifiable, like obesity. Some of the risk factors are not modifiable. So we can list a number of risk factors for ovarian cancers, as we said already.
Doctor, what are the signs and symptoms of ovarian cancer and how can it be prevented?
majority of the time, the signs and symptoms are non-specific. There is no specific signs and symptoms pertaining to ovarian cancers. Sometimes these patients present with abdominal distension. Sometimes it may be a bleeding per vaginum. Sometimes patient may present with a back pain. Sometimes patients present with a urinary tract infection-like symptoms. So the signs and symptoms are non-specific in the case of ovarian cancer. So if the age group risk factors are favoring towards diagnosis of ovarian cancer, better to get evaluated at the earlier phase itself rather than waiting for progression of symptoms to an advanced level.
Hello doctor, what is cervical cancer and what are the risk factors associated with it?
Cervical cancer is basically arises from the mouth of the uterus, which is also known as the cervix. Now, uterus is basically the womb where the childbearing is done when the mother is pregnant. So that part of our body is called the uterus. Now, at the mouth of the uterus, there is a small part called cervix, which is the site for development of cervical cancer, where the cervical cells become uncontrolled and grow rapidly to form a tumor or a mass. And there are many risk factors for cervical cancer. Like most common is human papillomavirus infection. So it's a virus which spreads via sexual contact. So anybody who is having early sexual encounter, like below 18 years of age, with multiple sex partners, or even with one sex partner, but who is a high risk, like who is himself or herself carrying human papillomavirus, or who is in turn having multiple sexual partners. These are the major risk factors for human papillomavirus. And there is no known cure for human papillomavirus, but once it's there, it remains inside the body. Other risk factors will be like multiple childbirths, especially if 3 or more. Childbirth, the first childbirth at a very young age, like less than 20. And some things are modifiable, like smoking. Smoking increases the risk. Now, having birth control pills or OCPs for a very longer period without supervision, these things can also increase the risk for cervical cancer.
Doctor, what are the signs and symptoms of cervical cancer and how can we prevent it?
That's a very good question, because most of the time the symptoms like bleeding or pain from the discharge from the cervix, they can happen much later. One particular symptom is postcoital bleeding, that is bleeding after having sexual intercourse because of the slight trauma. So if these symptoms are there, then definitely one should take advice from the doctor. And more important is the prevention. So one is to prevent human papillomavirus infection. That is the best way. So the answer is a cervical cancer vaccine, which initially we had 4 types. Now each vaccine has got 9 types of human papillomavirus vaccine, that virus covered. So it should be given preferably at a younger age before onset of sexual activity. And number 2 is, as I said, if human papillomavirus infection is there, that is not curable. But what we can do, we can do a regular checkup with pap smear, which is just taking a slide from the cells of the cervix periodic intervals and looking under the microscope. So once we find that there are abnormal cells which can give rise to cancer later, we can take care of that by various procedures. So in this way, we can prevent cervical cancer. And cervical cancer is a major health challenge in India. It's the second most common cancer in women, and it causes a lot of deaths. So we need to focus on these 2 preventive aspects. Number 1, vaccine. Number 2, regular screening with pap smears.
Thank you so much, Doctor, for spreading that information, especially on the cancers most prevalent in India. I would like all the women listening in fact, everyone listening in on this International Women's Day, that if you experience any of these symptoms, please do not delay and consult your doctors and make sure that you live a healthier life so you can achieve all those dreams that you aspire for. She Beyond Pain 2.0, an initiative by Alkem Oncology.